mynews.studio.
Picture a country made up of 1,000 islands, but where not a single baby is born with HIV, syphilis, or hepatitis B. How did the Maldives manage that?
That's our headline today. The date is 2025-11/17. The Maldives has just become the first country to eliminate mother-to-child transmission of HIV, syphilis, and hepatitis B, all at once. This isn't just a medical milestone. It really changes the conversation around global health.
The World Health Organization officially validated this achievement just last month. Now, what does that mean in practice? Over 95% of pregnant women in the Maldives receive comprehensive prenatal care. That care includes routine testing for all 3 infections.
Plus, more than 95% of newborns get a hepatitis B vaccine dose right after birth. That timing is key. If you miss that window, the infection can last for life.
So, in 2022 and 2023, there were 0 babies born with HIV or syphilis, and a national survey last year found no hepatitis B in young children. That means they've actually gone beyond the global targets for elimination.
The big question is, how did a small country, scattered over so many islands and with limited resources, manage this? Most countries struggle with just one of these diseases, let alone all 3.
Exactly. The Maldives had to overcome the same obstacles: distance between islands, not enough health workers, and reaching every community, including migrant groups. Their solution was to dedicate over 10% of their GDP to health.
Wait, 10%? That's a huge share compared to most countries.
It is. That's among the highest health spending rates in the world. But it wasn't just about the money. The Maldives made sure everyone had access to healthcare. Free checkups during pregnancy, free vaccines, free tests on every island, no matter how remote.
And they didn't do it in isolation, right? Partnerships with WHO and UNICEF brought in technical expertise, digital health tools, and ways to monitor quality. But I'm curious, how big of a role did digital systems actually play?
Digital systems were really central. Every pregnancy, every birth, every test result, those were all tracked in real time. So, if a problem popped up anywhere, even on an island hours away by boat, the system would flag it immediately.
That's how they kept coverage above 95%, not just by starting a program, but by being able to see when something slipped and fix it fast.
Right. The real story isn't just reaching high coverage, but maintaining it year after year and spotting issues before they lead to new cases.
But can this be copied elsewhere? Or is it just a Maldives story? Is there evidence it could work in other settings?
Actually, it fits into the WHO-UNICEF triple elimination framework. That means integrated care, digital tracking, and working across different sectors. Principles that any country could adapt. The evidence is in the results. No new cases, WHO validation, and strong national data.
Let's look at the future. How will the Maldives keep these results going? Because diseases can come back if you let your guard down.
They're strengthening what's already working. Better labs, deeper digital integration, and more outreach to groups who might otherwise be missed. Plus, with ongoing WHO and UNICEF involvement, there are regular external checks built in.
And they're also sharing what they've learned, right? That's key for global health. Other countries can actually use this blueprint: universal access, integrated services, digital monitoring, strong partnerships. This isn't just a theory. It's already working.
It's rare to see a small nation leading the field in public health, but the Maldives shows that with the right investment and coordination, even tough challenges like these can be overcome.
So the Maldives hasn't just changed its own future, it's shown a path forward for others. As the world works toward the UN Sustainable Development Goals, these lessons could save millions of lives.
To wrap up, universal screening, timely vaccines, digital records, and strong partnerships, those are the pillars of Maldives' success story.
And the takeaway? Even countries with limited resources can reach ambitious public health goals, as long as they build the right systems.
That's it for today's episode. Thanks for listening. This episode was powered by mynews.studio. Give it a try for free.